All right, hello, my name is Haley. I'm going to be your nurse today. We're just here to do your neurologic assessment. So I'm going to ask you a couple quick questions. Can I get your name, your date of birth, and where you are?
My name is Tabitha Fishberg. My birth date is 4/25/89, and I am at St. Luke's on the Plaza.
All right, very good. Okay, so earlier they took your vital signs. I'm just going to go ahead and go over those with you, okay?
Okay.
So your blood pressure was 110/64. Your heart rate was 84. Your respiratory rate was 14 breaths per minute. Your O2, which is your oxygen, that's 99% on room air. And then your temperature is 98.4. So all of those are within normal limits, and those are good.
Okay.
Do you have any questions?
Mm-mm.
Okay. All right, so we're just going to go over a few things. So first, I'm just going to go ahead and tell you, I'm going to tell you 3 words, and then about 5 minutes or so, I'm going to ask you those words again, and then I'm just going to have you repeat them to me, okay?
Mm-hmm.
So I'm going to go ahead and tell you the words. They are flower, table, pen.
Flower, table, and pen.
Okay, good job. All right, so then are you in any pain right now on a scale from 0 to 10, 10 being the worst pain?
0.
0? Okay. So usually whenever we are assessing pain, we assess characteristics like when the pain starts, how bad it is, things that make it worse or better, if it's sharp, dull, things like that. Okay. All right. So just a few more questions. Can you tell me who the president is?
Trump.
Okay. Who was the president before Trump?
Obama.
All right. And who was the president before Obama? Bush. All right. Good job. Okay. So you seem calm. You seem very alert, and you have a pleasant affect. In your posture, you're sitting upright, it's appropriate, erect, things like that. And it's been about 5 minutes, so I'm going to go ahead and ask you those 3 words that we talked about earlier. Can you go ahead and tell me those 3 words?
Flower, table, and pen.
All right, good job, Tabitha. Okay. And your speech pattern is very clear, so that's good. We're just going to move on to the next part of the assessment. We're going to be assessing some cranial nerves and do some tests in between there, okay?
Okay.
So the first thing we're going to do, we're testing cranial nerve 12 and its function. I'm going to have you stick your tongue out and then move your tongue from side to side. All right, good job. Then we're going to assess cranial nerve 7. I'm going to have you go ahead and smile. Okay, good, that's symmetrical. And then I'll have you raise your eyebrows. All right, and I'll have you close your eyes tight. Good job. And I'll have you go ahead and puff out your cheeks. All right, good job. And that was assessing cranial nerve number 7. Then to assess cranial nerves number 2, 3, 4, and 6, I'm going to use this pen light here. I'm going to shine a light in your eyes, okay?
Okay.
So we'll go ahead and do that. All right, very good. And then we're going to use this. I'm going to use the tip. I'm going to have you look straight forward. I'm going to move the pen light around, and I just want you to follow the pen light with just your eyes. Don't move your head, okay?
Okay.
All right, you're doing good. Okay, and so then I'm just going to have you go ahead and swallow for me. All right, any difficulties with that?
No.
Okay, so then I'm just going to use this tongue depressor, and we're going to check your gag reflex. So I'm just going to put this in your mouth, okay? Okay, good job, Tabitha. All right, and then we're going to test some other cranial nerves. So what we have is we have a scent over here in this cabinet. So what I'm going to do is I'm just going to have you close your eyes. I'm just going to wave the scent under your nose, and you just tell me what you're smelling, okay?
Okay.
So go ahead and close your eyes. Can you tell me what you're smelling?
It smells like apples.
Okay, very good. It is apples. All right, and then we're just going to, that was cranial nerve number 1. That was for your smell. Then we're just going to test cranial nerve number 8. That has to do with your hearing, okay? So what we'll do is I'll have you close your eyes. I'm going to make some noises by your ears, and I just want you to tell me which ears you're hearing it by, okay?
Okay.
So go ahead and close your eyes.
Right. Left. Left.
All right, good job. Okay, and then we're going to check cranial nerve number 5. And so for that, I'm going to have you open your mouth. I'm going to put my hand underneath your mouth. I'm going to have you open it with my hand pressing, okay? Go ahead. All right, good job. Okay, and then we just need to test cranial nerve 11. So for that, I'm going to have you rotate your head to look from side to side and up and down. Okay, good job. So then we're going to have you shrug your shoulders. Okay, so then rotate your shoulders forward for me. All right, go ahead from front to back. All right, good job, Tabitha. You're doing great. Okay, so then we're just going to check some other things. I'm going to stick my fingers out and just have you squeeze them for me. All right, good job. Those were strong and equal bilaterally. And so then what I'm going to do is I'm going to have you close your eyes, and I'm just going to have you put your arms out, okay? So go ahead and close your eyes and put your arms out. All right. There's no dropping or any abnormalities. You can go ahead and lower those and open your eyes. And then we're going to check some things with your feet, okay? Okay, so I'm just going to come over here. All right, so what we're going to do is I'm going to put my hands underneath your feet. I'm just going to have you press on my hands. All right, very good. I'm going to put them on the top and press up for me. Okay, good job. So then we're just going to use the end of this reflex hammer here, and we're going to check something that's called the Babinski reflex, okay? Okay. So I'm just going to put this on your foot. Okay, so I'm just going to go ahead and use this. Okay, you're doing good. All right, good job. And then some other things we're going to do, I'm going to have you close your eyes, and then while your eyes are closed, I'm going to touch some parts on your body, and you just tell me where I'm touching, okay? Okay. Okay.
Right calf. Left thigh. Left calf. Right calf. Right thigh. Left arm. Right arm.
Okay, good job. And then some other things that we're going to do, we're going to put this up here. And then I'm just going to use this cotton here. I'm going to have you close your eyes. Okay. And I'm just going to touch certain parts on your face, and you just tell me where I'm touching, okay?
Left cheek. Right cheek. Chin. Nose. Right forehead. Left forehead.
All right, good job, Tabitha. Okay, so then we're going to have you go ahead and stand up, and we're going to check some things. So we're going to check something that's called the Romberg test. Move this out of your way here. So whenever we're doing this, I'm just going to kind of stand behind you. We'll get these out of your way. So I'm going to stand behind you, and what you do for the Romberg test is I'm going to have you put your arms out, and then you're going to close your eyes, and you're going to lift one leg. While you're lifting that one leg, you're going to touch your nose with the opposite arm, okay? Okay. Okay, so I'm going to go ahead and stand behind you here. Go ahead and close your eyes and put your arms up. All right, go ahead and lift your leg. All right, very good. Okay, so then what we're going to do is we're just going to check your gait. So I'm going to walk with you, okay? So we're going to go ahead and walk this way. Okay. All right, very good. We'll go ahead and walk this way. All right, you can go ahead and sit down. Your gait is steady. Everything is looking good, Tabitha. You seem alert and oriented ×3. You have a Glasgow Coma scale of 15, which is really good. Okay. So your neurologic assessment has been great. What we're going to do is we'll send you with some more teaching education and things like that, and some more education about everything that we've done today. Okay. And then if you ever have any questions, or if you're having any other issues, anything like that, just go ahead and give us a call. Okay. All right. Do you have any questions at this time? No. All right. You did great today.
All right. Thanks.